Hello, my dear students. Welcome to my class. So today I'll be discussing about the hormones of the hypothalamus as well as the pituitary gland and their functions and the diseases which are associated with these hormones. Now look at this informative chart. As you have studied, there are a lot of hormones secreted by the posterior as well as anterior pituitary gland like vasopressin, oxytocin from the posterior part and gonadotropins, prolactin, thyroid stimulating hormone, growth hormone and ACTH from the anterior part. All these hormones are regulated by the releasing hormones that are secreted from the hypothalamus, right? Now see, all the hormones of the pituitary glands have their own target organs and they exert their effects in various ways in our body, right? So now if we talk about their functions, as you can see that these hormones regulate the water balance, they help in uterine contraction during labor, the gonadotropins, as you have studied, FSH and LH, they help in the production of sex hormones, in the production of sperm and egg as well. TSH regulates the metabolism and also helps in releasing T3 and T4. Likewise, prolactin helps in the production of milk from the mammary gland. Growth hormone obviously helps in stimulation of growth, and ACTH or adrenocorticotropic hormone helps in the production of glucocorticoids, helps in metabolism and the stress response as well. Now, look at this picture. This is the intermediate lobe of the pituitary gland. You would be surprised to know that this intermediate lobe of the pituitary gland helps in synthesizing and helps in the secretion of very important endocrine hormone, that is MSH or melanocyte stimulating hormone. Yes, this is the hormone which is responsible for the hyperpigmentation. And this hormone is also produced in the anterior lobe of the pituitary gland, right? And the another name of this hormone is intermittence. Before we start discussing about the pituitary disorders in detail, we must know about the cells of the pituitary glands which synthesize and secrete the hormones. Now look at this chart. There are different kind of cells like lactotrophs or the mammotrophs help in the synthesis and the secretion of the hormone prolactin. Whereas corticotrophs help in the secretion of ACTH, whereas gonadotrophs help in the secretion of gonadotropins like FSH and LH. Thyrotrophs help in the secretion of thyrotropin, and the somatotrophs help in the secretion of the somatotropin or the growth hormone. All right. So, in this slide, we are going to talk about the pituitary disorders caused by the hypo or hypersecretion of the hormones. So, the first hormone I'm going to pick is prolactin. All right. So, as you have studied that prolactin is a hormone produced in the anterior pituitary gland which normally stimulates milk production for breastfeeding in women. And the lactotrophs are sensitive to a variety of stimulating factors which can result in temporary or mild elevations of prolactin in the blood, which are not associated with any kind of problems. However, higher prolactin levels, if sustained, can cause disruption of reproductive hormone signals, resulting in low reproductive hormones, in estrogen in women and testosterone in men, as well as unwanted lactation. Significantly elevated prolactin levels can be caused by certain medications or by a prolactin secreting pituitary tumors known as prolactinoma, right? So, if we see about the symptoms that are associated with excess level of prolactin in our blood, we will see that in women and in men, there are a lot of changes that take place. In case of women, loss of libido, depression, headache, menopausal symptoms, infertility, weight gain, this kind of changes take place normally. And in case of men, there is again loss of libido, mood changes or depression, impotence, infertility, weight gain, and also gynecomastia. That is the growing breast. And another problem I'm going to talk about, note it down, that is excess prolactin typically is associated with varying degrees of gonadal failure and in some cases with spontaneous breast milk secretion, which is known as galactorrhea in men and women. Okay? Now, look at this beautiful chart. As you can see that the hypothalamic hormone dopamine acts as a prolactin inhibitor in our body. So, what could be the treatment for hyperprolactinemia? Yes, you have guessed it correct. The best way to treat high prolactin levels in our body is increasing the dopamine levels. That will automatically reduce the high prolactin levels. Cushing's disease is a rare disease characterized by obesity. The most common form of Cushing's disease is due to an excess secretion of the pituitary hormone ACTH or adrenocorticotropic hormone, which circulates in the blood and stimulates the adrenal gland. Now, what are the causes of high levels of cortisol in our body? Note it down, students. High stress levels in the final trimester of pregnancy, athletic training, malnutrition, alcoholism, depression or panic disorders, use of corticosteroid medications are the causes of high levels of cortisol in our body. And see, these are the signs and symptoms. If you see a Cushing's disease patient, you can see it very clearly that there will be upper body obesity with thin arms and legs. Buffalo hump will be there. Red round face, high blood sugar with elevated BP, vertigo, blurry vision, and acne will be present. Water retention, females with menstrual irregularities, and bruising will be there all over the skin. Purple or red striae, as you can see in this picture. Hirsutism, it's very common in Cushing's disease. I've given the picture here. You can see it very clearly. And besides these signs and symptoms, severe depression, poor wound healing, cognitive difficulties, sleep disorders, and fatigue will also be there. All right. Now, we will learn about gigantism. It is a pituitary disorder due to hyperactivity or excessive secretion of growth hormone, which is also known as somatotropin. So, the gigantism is characterized by excess growth of body with the average height of 7 to 8 feet. All right. Apart from the hypersecretion of growth hormone, tumor of acidophilic cells of anterior pituitary can also cause gigantism. Now, what are the signs and symptoms? Huge stature, like 7 to 8 feet height, should be there. Headache due to tumor of pituitary, very large hands and feet, thick toes and fingers, a prominent jaw and forehead, weakness, insomnia, coupled with other sleep disorders, visual disturbances, diabetes insipidus can be present, delayed puberty can be there in both boys and girls, and irregular menstrual periods in girls can be seen. All right. So now we will study about another disease which is also caused by high level of GH or the growth hormone in our body. I think all of you know this person, right? This is the great Mahabali Kali, the great professional wrestler from our India. Khali's acromegaly is an extremely rare condition caused by the excessive production of growth hormone, which affects about 6 out of 1 lakh people. In 2012, after his diagnosis, Khali had the tumor responsible for the excess hormone removed from his pituitary gland. So now let's talk about this rare disease. Acromegaly is the anterior pituitary disorder characterized by abnormal growth of the hands, feet, and the face caused by the overproduction of growth hormone by the pituitary gland. Now let's talk about the signs and symptoms of this disease. The striking features are protrusion of supraorbital ridges, broadening of nose, thickening of lips, thickening and wrinkles formation on forehead and lower jaw. Face with these features called as acromegalic or gorilla face. Now let me show you a photo of this kind of gorilla face. So, the other signs and symptoms are kyphosis, which is the enlargement of hands and feet with bowing spine. Scalp is thickened and thrown into folds. Overgrowth of body hair. Visceral organs are also enlarged. Thyroid, parathyroid, and adrenal glands shows hyperactivity, hypertension, hyperglycemia, glycosuria, and headache can be present with the presence of visual disturbance. That is the partial blindness where vision is missing in the outer half of both the right and the left visual field. This is also called bitemporal hemianopia. So, I think everyone is very familiar with this poster, right? So, in this movie, our King Khan acted as a dwarf, right? So, let's learn about the dwarfism. Dwarfism is the pituitary disorder in children characterized by stunted growth. Now, what are the cause of dwarfism? Reduction in the GH or the growth hormone in infancy or early childhood can be a cause. Deficiency of growth hormone releasing hormone from hypothalamus, it is the second cause. Atrophy of acidophilic cells in the adenohypophysis, it is the third cause. Or tumor of chromophobes or panhypopituitarism can be a cause of dwarfism. What are the signs and symptoms of this dwarfism? There will be stunted skeletal growth. Maximum height will be approximately about 3 feet. Head becomes slightly larger in relation of body. Mental activity is normal without any deformity. Reproductive system is not affected due to lack of GH, but note it down that in panhypopituitarism, puberty is not obtained due to lack of gonadotropic hormone. All right? Now, we will study about a rare disease in adults characterized by the atrophy of the extremities of the body. The disease is known as acromegalia. What are the causes of acromegalia? Deficiency of growth hormone in adults is the main cause of acromegalia. Secretion of GH decreases in various conditions like deficiency of GH releasing hormone, atrophy of acidophilic cells in the anterior pituitary, tumor of chromophobes, or in the case of panhypopituitarism, there will be low GH secretion. If we talk about the signs and symptoms of acromegalia, we will see that there will be atrophy and thinning of the extremities, and this is the major symptom associated with hypothyroidism, hyposecretion of adrenocortical hormone, and the person will become lethargic and obese, and there will be loss of sexual function. The another disease which is due to the hypoactivity of the pituitary gland is called Simon's disease. It is a rare pituitary disease where weakness and wasting of the body due to severe chronic illnesses is very common. It is also called cachexia and occurs mostly in panhypopituitarism, atrophy of the cells and organs that are normally stimulated by the pituitary hormones can be seen. What are the causes of this Simon's disease? Tumor presses on the optic nerve and surrounding brain structures, complication of pregnancy, so the postpartum hypopituitarism or postpartum pituitary gland necrosis can be the cause of the Simon's disease. If we talk about the signs and symptoms, we will see that they will be developing senile decay due to the deficiency of hormone from the target glands of anterior pituitary, that is the thyroid gland, adrenal cortex, and the gonads. There will be loss of hair and the skin on the face becomes dry and wrinkled. It is a very common symptom of cachexia. In this slide, we will be studying about the syndrome of inappropriate antidiuretic hormone secretion or SIADH. It is a disease characterized by loss of sodium through urine due to hypersecretion of ADH or antidiuretic hormone. What are the causes? Due to cerebral tumors, long tumors, and lung cancers, because the tumor cells secrete ADH, it can cause this syndrome. Normal secretion of ADH makes the plasma hypotonic. The third cause is hypotonic solution inhibits the ADH secretion and restoration of plasma osmolarity takes place. But in SIADH, secretion of ADH from tumor is not inhibited by hypotonic plasma. So what are the signs and symptoms? There will be loss of appetite, weight loss, nausea and vomiting will be there, headache, muscle weakness, spasm, cramps, fatigue, and restlessness and irritability will also be present. In severe conditions, patients die because of coma and convulsions. Now, we will learn about diabetes insipidus. It is the posterior pituitary disorder characterized by excess excretion of water through urine. All right. What are the causes of this diabetes insipidus? It develops due to the deficiency of ADH, which occurs in various conditions like injury or degradation of supraoptic and paraventricular nuclei of hypothalamus, atrophy of posterior pituitary, lesion in hypothalamo-hypophyseal tract, or inability of renal tubules to give response to ADH hormone. It is also called as nephrogenic diabetes insipidus. What are the signs and symptoms of diabetes insipidus? Number one is polyuria. So the excretion of large quantity of dilute urine with increased frequency of voiding is actually polyuria. Right. So due to the absence of ADH, the epithelial cells of distal convoluted tubule in the nephron and the collecting duct of the kidney becomes impermeable to water. Here, the daily output is more than 4 liters. All right. Another symptom is polydipsia, which is the intake of excessive water, and the other symptom is dehydration. In some cases, the thirst center in the hypothalamus is also affected by the lesion. Therefore, water intake decreases in these patients and the loss of water through urine is not compensated. The other signs and symptoms of diabetes insipidus are dry mouth, changes in the skin elasticity, there will be low BP or the hypotension, there will be elevated blood sodium or hypernatremia, and fever, headache, and electrolyte imbalance. The last disease or the disorder I'm going to talk about is dystrophia adiposogenitalis. So it is characterized by obesity and hypogonadism, affecting mainly adolescent boys. It is also known as frolic syndrome. So adipocogenital dystrophy is a rare childhood metabolic disorder characterized by obesity, growth retardation, and retarded development of the genital organs. It is usually associated with tumors of the hypothalamus, causing increased appetite and depressed secretion of gonadotropin. Okay. Symptoms will be obesity. It is a very common feature in this disorder. Sexual infantilism or the failure to develop secondary sexual characters will be there. Dwarfism occurs if disease starts in growing age. It is called the infantile or prepubertal type of frolic syndrome in children. The other features are loss of vision and diabetes. So with this, I'm going to wrap up my video here. Thanks for watching this video and please do subscribe the SNCW official YouTube channel.